I join the many Kenyans to honor all women who have been in the front line last year and to date in our fight against COVID-19, as doctors, as paramedics, as nurses, as community health workers. And I say to all of you, Happy Women's Day.
8th March of every year marks the International Women's Day. Here in Kenya, this day was marked in several places, regardless of the COVID-19 pandemic.
As women, must continue to raise our voices and protect ourselves against harmful practices such as FGM and early child marriage. These factors impede our pathway to reaching our gifted potential.
In Baringo County, over 350 girls who had dropped out of school owing to teenage pregnancies got a second chance to continue with their studies.
If these girls did not get a second chance, maybe they would get married and they could be wasted.
This led for the need to set aside funds through the government's Affirmative Action Fund, which saw the girls sponsored with 10,000 Kenya shillings to cater for the whole year's school fees.
Nilikaa mpaka karibu 2 years, mtoto afike 2 years. Nikasema nikikasa kwa nyumbani, kama siendi shule na sipani kazi nyingine, wacha tu niende niombe tena na wazazi wangu msamaha. Nikaenda kumpata baba, akaniambia hutarudi tena shule. Nimekuambia sitakusomesha. Nikakuja kupata mamangu. Mama akaniambia sasa sina pesa, tutafanya nini?
In Garissa County, women have been called upon to vie for political seats so that they can be included in policy making.
Today, we are reflecting what my mother went through, what your mother went through.
Kama sisi wakina mama ni muhimu tushikane mkono na tupe wao fursa, tusaidiane. Wale wamama wapewa nafasi kubwa, wanashughulikia, tusaidie na wao.
On their part, women under the Central Organization of Trade Unions, COTU, are calling on the government to ensure women's safety and equality, especially in workplaces.
In this 21st century, it is very wrong for women workers to be humiliated. That's why we are demanding that the government of Kenya must ratify Convention 190. Ndio wamama walindwe wakikuwa kazini. Wakina mama walindwe wakati promotion zinafanywa, so that they are being given a fair platform to compete and to work well with men.
We are not only advocating for women, we are also advocating for elimination of violence and harassment against men. We don't want to see any unacceptable behavior, and we are saying gender-based violence is not part of the job.
At Uhuru Park grounds, the Kenya National Blood Transfusion Service held a 3-day blood drive to collect over 3,000 units of blood to contribute towards treatment of postpartum hemorrhage among Kenyan mothers, considering excessive bleeding after childbirth is the leading cause of maternal deaths in the country.
By having and providing the opportunity for mothers to be able to get healthcare services when they need them, and in particular acute care, in particular blood, is one of the biggest contributions that we can make.
Donors also encouraged others to come forth and donate blood in order to save lives.
I also feel it seeing women lose a lot of blood and losing their lives, leaving their newborn babies without mothers. So it's a privilege that I get the chance to donate blood this time, and I'm looking forward to donating more and more blood so that I can save more lives.
Donation of blood goes beyond just maternal health, but also there are other people who are in need. I'm a universal donor, all resource positive. So I also appreciate that there are those who at times need blood, and only those who are willing to give can support.
One way of celebrating women is ensuring that they are in good health. We can do this by donating blood frequently to ensure that we save thousands of women who lose their lives during childbirth due to excessive bleeding. Robbie Omondi, K24, Nairobi.